Since we started using HealthInfoNet, the amount of time that it takes to do an MTM has been dramatically reduced. It would take us on the phone anywhere from 45 minutes to an hour sometimes, answering questions while the person was on the phone. Now the information that we can get before we even pick up the phone to populate these MTMs is very complete, so that the time spent on the phone is very much more pointed to the answers that we cannot figure out, that we really need that patient's interaction. Another thing that HealthInfoNet has really put light on to is how to fix our QIP measures. Our QIP measures are basically scores that come out of Medicare, and they look at different parameters like days physician covered, narrow therapeutic index drugs, and having some of the lab data to be able to put on a form, to fax a physician, to tell them this is why we need a change versus we need a change, to give them evidence-based reasons to make a decision versus you have to change this because it's wrong, and allow us to give them options so that they can actually select an option versus giving them a problem to solve. So the information that we've gotten from HealthInfoNet has been able to fix that. The next thing at HealthInfoNet has really been a big influence at Milledrug is because a lot of the programs that we run associated with diabetes education and tobacco cessation really focus around wellness and how we can really be there for our patients and make them a little bit more healthy as things going forward. The information that HealthInfoNet provides us, past weights, BMI, whether they've tried smoking cessation or not, what they've tried or not, their A1Cs for the diabetes, their fasting glucose, their cholesterol measures, all these things factor into how we try to take care of them. And a lot of people, you ask them a simple question like, what's their cholesterol? And they said it's good. But now we can go in there and break that down and show them where they started, where they are, and hopefully where they're going to be going, and what medication they're on, and make sure it's appropriate. And if they're not, we give them information to talk to their doctors more effectively instead of just being told what to do. One unique area that HealthInfoNet has really bridged the gap between physicians and pharmacists is at our cancer care center in Brewer at the Lafayette Cancer Center. Our pharmacist has really been able to tie in diagnosis, lab values, different treatment regimens with the prescriptions that come down to treat patients that have cancer, so to make sure that the doses are correct, they're taken in a safe manner, that we're monitoring parameters as we go down, and that we can actually explain to the patients why a certain thing is happening to them and what we can do to either help it or reach out to the physician and say maybe we should back off at a certain point. It really has decreased the amount of interaction and time that we spend talking on the phone with the physician because we have their information already. So we're not really tying them up. It's not like we're bothering them, but they have to take care of more patients, and this gives them the opportunity to do that. And we have to take care of more patients, and by having that information shared and bridging that gap between us has really increased the level of service and care that these patients have received at the cancer center.